Hi, my name is Gibson, a PhD graduate from the University of Strathclyde. Today I'm going to take you through the results from the final study of my PhD, which was titled Evaluating Usability of a Tablet Application to Support Adults with Mild Intellectual Disabilities during Primary Care Consultations. First of all, I will explain why it is necessary to embed novel communication technologies in the primary care domain. Back in 2012, an inquiry into the premature deaths of people with intellectual disabilities was launched in the UK, which analysed the deaths of 247 patients across various practices in the southwest of England. The researchers classified 42% of the deaths as premature, with up to 27% of the cases also amenable to better quality care. In addition, patients were suffering from an average of 5 long-term or treatable conditions at their time of death, some of which were straightforward to diagnose and cure. So as you can see, health inequalities have a significant effect on the length and standard of lives experienced by people with intellectual disabilities. Unlike many of the barriers cited in literature, challenges in communication may be alleviated almost instantaneously via the introduction of AAC, augmentative and alternative communication. Nevertheless, a scoping review conducted by our research team concluded that there was a lack of high-tech two-way communication aids employed in practice. 10 adults with mild ID were subsequently invited to participate in a series of design workshops and suggested that the collection of an accessible list of symptoms prior to the consultation could help to improve the exchange of medical information. The requirements identified by the participants were embedded in the prototype shown in the left-hand side. It consists of an adaptive questionnaire that responds to the individual health context of the patient. Core questions based on body parts or significant symptoms are initially presented to the user, with their response determining whether additional questions related to that query are presented. 3 separate modalities were used to convey the question and answers: plain language that avoids the use of medical terms, audio which highlights each of the phrases on the screen and plays back the text, and identifiable imagery to complement the text. 3 sets of images were implemented with the ability to switch between these sets via the button located in the centre of the screen. To select an answer, the user taps on the relevant image prior to the right-hand arrow, and once the questionnaire is complete, all selected answers are listed in the results page. The prototype was evaluated by 3 separate populations across 2 studies. 5 experts and 4 caregivers conducted virtual cognitive walkthroughs individually. The experts worked in HCI for a minimum of 6 years, ranging to 15, and had worked alongside people with ID for at least 3 years, ranging to 25. Both paid and unpaid caregivers were recruited and had the minimum experience of 4 years, ranging to 21. Participants had to observe a researcher filling in the questionnaire for symptoms of a sore, tight chest, with experts answering the traditional cognitive walkthrough question set after each sub-step, and caregivers answering the more streamlined proposed by Spencer. Unique usability barriers were tagged and ranked using Nielsen's severity rating scale. 5 GPs were recruited to participate in virtual cognitive walkthroughs as well. Full and part-time GPs were identified, ranging from a newly qualified GP who worked in a rural area to an individual with 25 years experience working in an urban practice. GPs had to work through the questionnaire for the same symptoms before discussing their experience afterwards. Verbatim transcripts were then subjected to a framework analysis to identify the key barriers and facilitators to the implementation of the app in current practice. Unfortunately, we were unable to recruit patients due to COVID-19. Participants suggested several improvements to increase the usability of the application. First, images of the question should be presented rather than the answers to overcome situations where the differences between the yes and no images used are negligible. In addition, patients should be able to import their own image set, meaning the image change button is no longer necessary, since the user should not be able to navigate away from the set that they are already familiar with. Some of the questions were deemed to be cognitively challenging for patients with ID and require support from caregivers. Colour or symbols may be used to highlight when this is the case. The adaptive nature of the questionnaire could be communicated more clearly via the introduction of a progress bar, along with a mechanism to return from incorrect branches. The summary page should focus only on the yes answers to allow patients to locate the information they require more easily. Nevertheless, medical professionals should have access to the no questions if needed. Overall, the participants felt that the application has the potential to improve communication, diagnosis rates, and reduce time constraints, and offer an alternative means of consultation for those who find it stressful attending physical consultations.